Hey guys, I have really tried to record this video like probably 5 times already, and the storage on my iPad, which is what I usually use, um, is just getting full because I've been taking so many pictures of the baby. And anyway, so he's finally down for a nap. My husband's out of the house, so I can use his office to record this video. So this is gonna be Cole's labor and delivery story. I have some notes down on the desk here, so if you see me looking down, that's what I'm looking at. Two things to note before I get started is I had gestational diabetes with Cole, and I also tested strep B positive. Those are two things that had an impact on my labor and delivery, as well as Cole's treatment after he was born. Cole was due on October 29th. We had a couple of growth scans at 36 and 38 weeks. They were projecting Cole to be 9 pounds at birth. That is pretty common for gestational diabetes babies to be a little bit bigger. I was really concerned about his size. The doctor didn't seem very concerned. They did not recommend early induction or a C-section or anything like that. So I was really scared. At 4:30 in the morning on October 28th, the day before Cole's due date, I woke up out of my sleep because I felt a gush of fluid. I say gush, but it was a lot of fluid. It was more than like normal discharge. Sorry, I know that's TMI, but as per usual in a labor and delivery video, you're gonna hear a lot of things like that. So I felt this gush of fluid. It was more than normal discharge, less than what I thought your water breaking would feel like. So, but it was enough to wake me up out of my sleep. So I went to the bathroom to see if things were still leaking or what was going on, and I really didn't see anything. But my underwear was wet, so I ended up changing my underwear, putting on a pad to see, if it progressed any or if I was just crazy. Now, I never had issues with holding my bladder when I was pregnant. Everybody tells you you're gonna sneeze and pee yourself and all this stuff. I never experienced that. I didn't have a problem with that. So I was certain that I hadn't peed myself, which is, some people mistake peeing themselves for their water breaking. I knew that wasn't it. So anyway, I went back to bed, put on a pad and went back to bed, and I was really having trouble sleeping because I was excited. I think in my mind I sort of knew that this was the beginning of something. I had Braxton Hicks contractions on and off for a long time. Nothing really painful, but they were enough that I had downloaded a contraction timer and started tracking them pretty regularly. And so I had a feeling that he was coming soon, but and I had lost my mucus plug the night before the 28th, so on the 27th, I lost the mucus plug, and so I just thought, it's a matter of time. But anyway, I couldn't sleep, and my husband's like, what's going on? Like, what is wrong with you? And I'm like, I don't know for sure, but I'm pretty sure that my water broke. And so he said, you ought to get up and call the nurse. So I got up and was gonna call the nurse, and then I started thinking about it, and I'm like, they are just gonna tell me that I need to go into the hospital to have the fluid checked to determine whether or not it's amniotic fluid. So the point of calling, it's really a moot point of calling the nurse. They told me if I was strep B positive and my water broke, I needed to go right in. So I just decided I wasn't going to call the nurse. I was going to go ahead and take a shower, then start getting ready to make our way to the hospital. Now, at this point, I was not having contractions, nothing more than the regular Braxton Hicks. So I was not in pain. There was no other indication that he was coming soon other than just I was having the fluid. Now, when I went to go into the shower, the fluid did pick up some, but still it wasn't this massive leakage of fluid everywhere, but it sort of made me sure of my decision that it was time to go to the hospital. So took my time, took a shower, my hospital bag had been packed for a very long time. I was super excited. So I didn't have to worry about that. There was just a couple things I had to stick in there at the last minute, like my cell phone charger and hairbrush, and remember to bring my pillow, which was the best thing ever. If you're pregnant and thinking about it, take your pillow to the hospital because their pillows are awful. So even in our pictures of right after Cole was born, you'll see my green pillow in the bed with me. Anyway, so I took a shower, got ready, Scott got up, took his shower. I knew that I should go ahead and eat something because once you're admitted to the hospital, at our hospital, you can't eat until after the baby is born. So we were going to go out to breakfast, but it was only still probably 5:30 at this point, and nothing around us was open. So I had a bowl of Cheerios. If I had that to do over again, I definitely would have waited and gotten a really big breakfast because we were in for a very long day. So at 6 o'clock, we got to the hospital. I had pre-registered, so that was nice. We just had to tell them who we were, and they sent us upstairs to labor and delivery triage. Now, in our hospital, you don't go through the emergency room. You go right to the women's center, and they keep you separate from the rest of the sick people, which is kind of nice. So they send you to this labor and delivery triage area where the nurse tried to do a nitrazine test, which is just a strip of paper that they sort of just dab it on the outside of your vagina to pick up that fluid, and it changes colors. If the fluid is amniotic fluid, it changes to a certain color. I don't know what color it is, but anyway, I had taken a shower and really hadn't had a whole lot more leakage, so the test didn't pick up for me. So she said, no problem, we'll just check your cervix, and when we do that, we can get some fluid from inside. So I thought, okay, sure, no problem. So at this point, things started to pick up a little bit. I still wasn't in pain, but I was leaking a little bit more, like embarrassingly leaking as I was changing into the hospital gown. It's like leaking onto the floor. So she went to check me. I was dilated to a 2 at that point, and but unfortunately when she did check my cervix, it irritated my cervix, which caused some bleeding. And the bleeding interferes with the nitrazine test, so she could not get a conclusive result whether or not it was amniotic fluid. So I was told at this point at 6:30 to go walk for an hour. I was having contractions that registered on the monitor, but I wasn't really feeling them. So she said, go walk for an hour, come back. Maybe your bleeding will have slowed that we can successfully do the nitrazine test. So we walked around the hospital for an hour. My contractions picked up. I was hurting pretty bad by the end of that hour. At 7:30, when I did come back, our hospital does 7 to 7 shifts. So the nurse that I was dealing with had already gone home. So we had a new nurse who was like new. Like, I think it was her first day on the job. So she came in to try to do a nitrazine test, and still I was bleeding too much for that to work. So the doctor that was on call, who of course was a doctor I had never seen before, the practice that I went to rotates you through doctors, but there is one older doctor who does not deliver babies anymore, who's always in the office. So probably 80% of my visits were with him. Which is unfortunate because if he's not going to deliver babies in the hospital, he shouldn't be doing the OB visits, because if the purpose of rotating you through doctors is so that you get to know everyone, so that whoever delivers you might have seen before, maybe he should just stick with GYN. But I digress. Anyway, this doctor I'd never seen before, but I liked her. Okay. Decided to do a different type of test that I don't know the name of this one, but they use a swab, and it has to be inserted and then held there for 1 minute, and then they put it in some type of solution that changes color. And I hear her out there explaining to the nurse how to perform this test. So I'm like, great, this nurse has never done this before. This is going to be awkward. So they attempt to do that test again. Too much blood, didn't register. So the doctor comes in and she's like, okay, we're going to have to do a Ferning test, which is where they get some of the fluid, they put it on a slide, and they look at it to see if there's any ferning, much like you might do to see if you're ovulating. And so the way they do that is a lot like a pap smear, so legs up and all that. So nurse had trouble getting the legs up on the bed. Like, I don't know, it was just kind of frustrating. Anyway, so the doctor goes to do this test, and she goes, yeah, I see a lot of fluid. I think you're right. It's definitely amniotic fluid. I'm going to go check it just in case, but be prepared that you're probably going to stay a while. And so what she told me is I had what you call a high leak, and so the membranes had ruptured, but not all the way, and it was way up high, and so they may still have to break the rest of my water later. What they determined was that the water had broken. I wasn't yet in true labor. They were going to have to admit me and induce labor. And the way they were going to do that was to administer Cytotec, which are two tiny pills that they put inside of your cervix to help it dilate. And because if they start Pitocin before you're really dilating, it's sort of counterproductive and it's painful. So they gave me some Cytotec, one Cytotec, and you have to lay flat for 1 hour. All this time they're monitoring the baby, as well as giving me antibiotics in the IV every 4 hours because of the strep B positive. And then they're checking my sugars every time they administer the antibiotics. Every time my sugar is low, which is not surprising, I haven't eaten since that morning, and they would not let me eat. Just kind of frustrating. So they're checking my sugar. Every time they check my sugar is low, and they're giving me apple juice. So that was kind of obnoxious. They ended up giving me 2 doses of Cytotec between 9 a.m. and 3 p.m. And at 3:15 they said, okay, now you're dilated 2 or 3, and we're going to start Pitocin. And so they came in and started the Pitocin at the lowest dosage. She said, you may not feel anything right away, but about that time is when my water broke the rest of the way on its own. And so not only did they start Pitocin, but I'm pretty sure my body started laboring on its own at that point, and things got really intense really fast. And thankfully, the contractions made me need to go to the restroom. So I told my husband, like, now hurry up, help me to the bathroom. Which I know that sounds really gross, but I was really happy about it because I was like, I absolutely do not want to be the person that has the bowel movement on the table. And I don't know if I did or didn't at this anymore because I didn't ask, and I'm pretty sure they probably just don't tell you. And I know it's really common, but I feel like at this point my bowels emptied. So I was in a lot of pain. I was holding out, trying to hold out for the epidural until I made it to a 6 because we were told in the class I took at the hospital, if you can make it to a 6, then the epidural will not slow down your labor. So I was just really hanging in there trying to make it work. Now they were trying not to check my cervix really often because I was strep B positive and my water had broken, but at 6:15 I asked to be checked because I was in so much pain. And so I had only made it to a 4 at this point. We were at 14 hours since my water broke. I was at a 4. Contractions were going really well. Really well, and the nurse said, you know, if you're in a lot of pain, there is no like time that you have to wait to get this epidural. Like, you can have the epidural whenever you want it. And I told her that I was trying to wait till 6 because of what they had told us at the class at the hospital. She kind of rolled her eyes and she was like, does it matter if it slows down your labor if you're not in pain? And I never really thought about it that way. I guess I don't know, I just hadn't. So I was like, okay, sure. She goes, it's a good time now. Shift changes at 7. If you wait too long, then you're going to be waiting on everybody to get caught up on the patients and all that. So I said, fine, just, yeah, bring me the epidural. So around 7, the doctors came in. They gave me the epidural. Mine went pretty smoothly. I mean, it took them some time to get it placed. It wasn't as bad as I thought it was going to be. Of course, I was in a lot of pain, so anything would have been okay at that point if it would have helped me. So she gave me the epidural. She told me to wait 30 minutes and press the bolus button just to keep the pain controlled, and then after that only press the bolus when I felt like I needed it. But as soon as they gave me the epidural, my blood pressure dropped, and the baby reacted to that. I'm not really sure what that meant. How did he react? I don't know, but the doctors watching him on the monitor, I guess his heart rate reacted, and so they had to administer ephedrine to me to bring my blood pressure back up. And so that was kind of crazy. It made me feel like I could feel my heart beating in my chest. It's kind of scary. And then after the 30 minutes, I pressed the bolus like they had told me to, and my blood pressure dropped again. And so the anesthesiologist came in and said, we're going to have to give you the ephedrine again, and I'm going to have to turn down your epidural, which scared me a little bit because it was working really well. Like, literally, I could not feel anything. But they got that straightened out, and even though she lowered the dosage, my epidural was still working very well. At 9 o'clock, they came in, they re-administered the antibiotics for strep B positive and checked me. I was 5 centimeters and 90% effaced at that point. We were in this mode of trying to get rest because we knew that we were going to be up for a while once pushing commenced and once the baby was born. So Scott laid down, I laid down. We were just sort of just laying there. I didn't really get good rest because every time you move, they have to readjust the monitor for the baby, and I just couldn't really get comfortable, and I was excited and scared and all those emotions that are going through you. And I'm not really sure at what point it was, but they did check me again between 9 o'clock and, well, let's see, they only would check me every 4 hours. So if they checked me at 9, then it was probably around 1 a.m. when they checked me, and I was 8 centimeters. And the nurse said, I'm not going to check you again until you tell me you feel the urge to push. So I went back to sleep. I woke up probably at 3:45 in a lot of pain, which was not abnormal, but it was just new because I'd had the epidural. I hadn't really been in any pain since they gave me the epidural. And it was a different kind of pain. It was like a pain down low. And so I pressed the call button and I told the nurse, I feel this pain. I don't know if that's normal at this point. Not really sure. So the nurse came in. She's like, I'm just going to check you then because, if you're feeling pain, it might be time to push. And of course, it was. He was in position. We were out of 10, 100%, or as close as you can be, ready to go. So she said, I got to call the doctor and let them know we're starting, but the doctor doesn't come in until the baby's ready to be delivered. So at 4:16, we started pushing. The first couple pushes were practice pushes. I did ask for the mirror so I could see more what I was doing because I really, really couldn't feel. I could lift my right leg, but I could not lift my left leg because depending on which side you're on, the gravity pulls the medicine from the epidural to one side of your body or the other. And since they don't want you just laying on your back the whole time, you're supposed to rotate. Generally, most people have a more numb one side to the other. For me, it was my left. So my husband literally had to pick my leg up for me so I could push. But after about 3 contractions worth of pushing, the nurse told me to stop. And I could see his head very well. She had to call the doctor. We were ready to deliver, and the doctor was in the middle of delivering another patient, so we had to wait. And so if you've ever been in the middle of pushing and they tell you to stop pushing, you know how frustrating that is because the pushing feels better. It feels good to push. It helps relieve some of that pressure and pain. But the doctor wasn't that long. She came right away. So we started pushing at 4:16, and at 4:42, Cole was born. They placed him on my chest, and it was one of the most wonderful moments of my life. I can't explain it to you. If you've had a baby before, you understand. He was 9 pounds 1 ounce and 20 3/4 inches long. He was so alert when he was born. He latched on right away. He was a great nurser. I unfortunately had a 3rd-degree tear, so there was some stitching that had to be done. But all in all, I worried so much about labor and delivery, and it was such a good experience for me. I had a really, really great nurse, and I didn't have a lot of pain during my labor and delivery. I just kept telling the nurse, like, I can't believe how easy this was. I can't believe how easy this was. So I feel very grateful that my pregnancy was pretty easy, and my labor and delivery was very easy. Now, after Cole was born, because of gestational diabetes, he had to have his heel pricked to check his blood sugars, and they were low, and so they couldn't give him a bath until he had had 3 consistent normal blood sugar checks. And this is where it kind of gets frustrating. At that point, I was having trouble getting him latched. It was me, it was not him. Like, once I figured out how to help him latch, he latched great. And had plenty of colostrum. So the lactation consultant came in, she helped show me how to do it, and then she showed me how to hand express some colostrum and then give that to him as well. And so once we did that, his blood sugar was great. I feel very fortunate to have had such a good experience. He was born on the 29th at, like I said, 4:42 a.m. and we left the hospital on Halloween at 6 o'clock. Right? No. The 30th. He was born on the 29th. They have to say 36 hours. So yeah, we left on the 30th at 6 o'clock at night. And it was just great. That was our labor and delivery story. If you have any questions, leave them down below, and I'll be glad to share them. I think that's all I have in my notes here. Yeah. So the next video I plan to do is some of our favorite things that we used between 0 months and 3 months. So newborn essentials, and some of the things that we didn't like so much. So be on the lookout for that video next. Have a great day, guys.